All right, so here we are for patient focused care discussion three, and we're going to be talking all about empathy. So to start off, what does empathy mean in the context of a therapeutic relationship? When is it appropriate to be used? So Cherry Kay from Very Well Mind 2020 defines empathy simply put as the ability to feel and understand the emotions of others. As if they were your own. So, the phrase of walk a mile in my shoes displays the concept of empathy. So, in terms of a therapeutic relationship, we know from what we've learned in class throughout the semester that one of the five components of the practical nurse client therapeutic relationship is empathy, which, when you think about it, it does make sense knowing, what we know about patient focused care and holistic care. How could we provide, comprehensive and beneficial care to a patient when we don't understand where they're coming from and can't be empathetic? Um, so empathy is, in my opinion, always appropriate in a therapeutic relationship because when clients feel understood, and that we are not judging them, but simply taking in what they're saying and responding empathetically, with just the focus solely on them, that's when they feel that sense of acceptance and established the trust that the therapeutic relationship is based on. So without empathy, that therapeutic relationship wouldn't be possible in the first place. So I think it is definitely appropriate within that setting. Empathy is also incredibly important because, I mean, from what I've already mentioned, but it's also one of the building blocks of nursing. So, like I said, without it, we don't have trust or understanding of our clients, which is essential in providing patient focused care because without that trust and without them feeling like we understand and accept them, they're not going to be. They're not going to be disclosing information with us if they don't trust us as well. They're probably not going to listen to a whole lot of what we have to say, and therefore will struggle with compliancy and following their care plan and interventions in place and things like that. So, I think empathy is a stepping stone and an essential building block in making that relationship and thus providing patient focused care. So now to use Walter as if Walter was our client, to provide an example demonstrating appropriate use of empathy and how it could help to optimize his care. Before providing an example pertaining to Walter, I just want to share something interesting, but not terribly surprising that I found. According to the Texas A&M International University, empathy has been proven to have many benefits when it comes to patient care. And these include improved patient outcomes, increase in patient satisfaction, more effective communication, and higher rates of patient compliance. Um, which, like I said, like I just wanted to add those in. But it's not terribly surprising that when we are providing empathy and establishing that good therapeutic relationship, that patient outcomes are improved because they trust us, they trust what we're saying to them. Um, they're disclosing information with us, allowing us to really specialize that care plan specifically to them. So yeah, it's working. The care plan is working. We're getting better outcomes. Patients are happier because they feel like their nursing staff really cares about them. Um, and not only that, is really listening to them and isn't being judgmental and is accepting what they have to say. More effective communication because once again, and when you take that step back and try to look at a situation from somebody else's point of view, that really just gives you the opportunity to maybe tweak your own communication to how they would best understand. Um, and then, of course, higher rates of patient compliance. So that just goes along with the improved patient outcomes. If patients are more compliant and following interventions and care plans, it only makes sense that if those interventions are being followed, that outcomes are going to be better. So I just wanted to share that because it also does pertain to Walter. But a specific example where I think empathy could have been applied to Walter and would have made a difference was in his travel situation. So getting either to his doctor, to the emergency room, or to his hemodialysis appointments. So a nurse could have applied empathy just by thinking to themselves, how would I feel as Walter after traveling 2 hours to sit in an emergency room and knowing that I have a 2 hour drive back home? Or how would I manage getting transportation 4 hours to this appointment and back 3 times a week when I don't drive? Same as Walter. How might I struggle securing transportation to my appointments that attempt to manage my chronic health conditions once again when I don't drive? So any of these, just to think upon like among yourself, as you're meeting Walter and meeting this patient that you have. Um, so they would have opened up like the conversation for the nurse to ask Walter more questions, about his transportation situation. And maybe it would be at this point, when we realize that he hitchhikes to many of his appointments, um, which for me personally, hitchhiking is pretty much one of my biggest fears and worst nightmares as a 22-year-old woman in 2022. So initially that elicits a reaction and a response in myself. But however, thinking of things empathetically isn't necessarily how I would feel if I was doing that, but how that person is feeling. So I would want to be sure, that I know and I'm aware of how Walter is feeling having to hitchhike and that type of thing. I mean, he is a 53-year-old man, and hitchhiking was quite popular back in the 70s and 80s. So there's a good chance that this is something that he's done his whole life, and to him, it's nothing more than an inconvenience, and it's not a big deal. So that's where we can just ask more questions and really try to know his understanding of how he's feeling about transportation issues, because like I said, for most people that would be their worst nightmare, hitchhiking. And just playing it by ear. How am I going to get to all these appointments that I have to, that are imperative to my health that I show up for, especially as hemodialysis 3 times a week? Like, those are big trips. They're 4 hours each way. So, I mean, that can most definitely elicit some stress for him, not knowing how he's going to get um, there and back. But, some people that might not bother them. I think in Walter's case and in his specific scenario, it is something that elicited stress in him that we know of, just by reading the scenario. But that's something that we would have only been able to find out having not read that, by asking him questions. So, rather than maybe for hitchhiking, for instance, if his fears are less about, being abducted or assaulted, maybe he's just really concerned that he's going to miss his appointments and he's going to have a hard time juggling to reschedule them, and that his conditions are going to continue to worsen, which we did see throughout the course of that scenario. So a transportation arrangement needed to be made to facilitate Walter being able to access his healthcare providers, and therefore receive care. So like I said, if we can get this topic brought up, of one of his struggles, of getting to and from appointments, this can empathetically be approached by saying something along the lines of, I can appreciate how challenging it is for you to get here for your appointments 3 times a week. So what can I do to help make that easier for you? So once we establish that there is a need, or an issue that Walter's experiencing, and he's given us information about it so that we can begin to understand it and understand how it's impacting him, that's where we can ask him, what can we do to help? Or let him know, hey, I believe that there are some resources in place to help people in your situation getting to and from appointments. So let me see what I can find and I'll get back to you. But the key with this one is most definitely make sure you get back to him. So that just goes along with the trust and the therapeutic relationship of don't make a promise and not follow through, or don't tell someone that you're going to do something and then don't do it, because that's exactly what it's going to do. He's going to think that we forgot about him, and it is most certainly going to break that trust that we'd established, by, inquiring about his transportation needs. And, if he is sharing things that maybe he's someone who isn't often, um, one to share about issues he's experiencing or anything like that, and he has shared with you, hey, I'm really struggling getting to and from my appointments. It makes me feel very anxious. I'm not knowing how I'm going to get there, especially where I have so many and they're so far away and I don't drive. If he opens all this up to you and you say, look, I think there's resources in place, I'm going to get more information and get it back to you, and then you never do, it's not that's not going to help facilitate that trust for him. And if you were being empathetic, acknowledging how challenging it must be for him getting to and from his appointments, you would not be displaying empathy by, telling him, I'm going to look into this for you, and then not getting back to him. So the key there, like I said, I think it's perfect to offer, resources, or let him know that, you believe there's something in place and you're just going to do some more research for him, but just be sure that you get back to him about it. Don't let him think that we forgot about him and his needs, because otherwise, like I said, it'll certainly be breaking the trust there. So we want to let him know that we really are looking out for him with his best interest in heart, and that we've taken the time to understand him and accept him for who he is, and the needs and the struggles that he is facing, and that we're going to do anything within our power, to help lighten that load a little bit for him, which is that's what we're here for. So with Walter, I think, had someone showed him some empathy, and understood his emotions and where he was coming from, I feel this had the ability to greatly impact his care in a positive way, not only eliminating the stress of travel, but making accessing care more accessible for him, and making him feel as though he has a care provider who understands and hears him. As it was very clear throughout the entirety of that scenario that he didn't feel like he was being heard or understood by anybody, whether that was in part to the language barrier and people talking too quickly for him. So he, like physically wasn't being heard by people. They were just brushing over him, or just in general, they were hearing what he was saying, but not understanding and not interpreting it and actually acting accordingly. Um, so, like I said, I feel like had empathy and patient focused care been utilized here, Walter's care could have been impacted greatly. Because as is the example that I just gave, if we could acknowledge that there was an issue there and set up some transportation arrangements for him so he could get to and from his appointments and not have to worry and be concerned about that, or be concerned about missing appointments if his transportation falls through. I think that could have, like I said, not only eliminated a lot of stress for him, but like I said, him just having a care provider that he thinks really has his best interest at heart, I think that would make a big difference in his care, especially where he does have so many chronic health conditions and sees so many different medical practitioners throughout the course of even just a month. Having someone who he feels hears him, and is really looking to understand him and make his life as easy as we can as healthcare providers, I think that would have made a really big difference for him and how he feels like he kind of navigated throughout the system. So with that concludes my patient focused care discussion 3. Thanks.